Kia ora. Factors influencing lung cancer. A Tableau analysis. My name is Nivantaka Galagedara. This is a part of my analytics storytelling course project at Unitec Institute of Technology, Auckland, New Zealand. Let's move into introduction. This project investigates the influence of lifestyle, environmental and healthcare related factors on lung cancer risk and survival outcomes. This is the research question based on the dataset. How do lifestyle, environmental and healthcare access factors influencing lung cancer outcomes across different countries and demographic groups? There are three sub-research questions. How does smoking behavior, including direct, second-hand and indoor smoke exposure, vary by gender and age group access across countries? Second, what is the relationship between socioeconomic status, healthcare access, and 5-year survival probability? Third, which environmental and access related factors, air pollution, occupational exposure, treatment availability are most associated with high lung cancer mortality risk? Now let's move into overview of the data set. The dataset consisted of 460,292 records, of which only 2,185 records were yes in the final prediction, dependent variable. Therefore, I used only these 92,185 records of data for my analysis. Age, mortality risk, and 5-year survival probability are numerical variables. The other 22 variables are categorical, which probably limits the visualizations. The world map shows the number of people in the study for the countries involved. The other two graphs depict how average mortality risk and average 5-year survival rate vary with people's age. There are interactions you can see when we select this one by one, country by country. Okay, now let's move into visualizations and insights. Smoking behavior and environmental exposure. The smoking status by gender stack bar chart does not show significant differences. Second-hand smoke exposure by gender pie charts indicates a male dominance irrespective of whether environmentally exposed or not. However, what I uncovered is discussed later under the findings. If you select one like this, you can see the interactivity. Then let's move into environmental and indoor exposure effects on mortality risk. Socioeconomic status, healthcare access and survival. Socioeconomic access status versus survival probability scatter plot showcases that higher healthcare access increases 5-year survival probability. Middle socioeconomic status has a limited variance in survival compared to high and low categories of the same. This is how the interactivity works. And let's talk about the mortality risk. Surprisingly, low air pollution exposure has the highest average mortality risk. Similarly, the group who have low air pollution exposure with indoor smoke exposure have the highest average mortality risk. You can see the interactivity like this. And now let's move into the findings. In this slide, we summarize key insights from our visual analysis of lifestyle, environmental and socioeconomic influences on lung cancer outcomes. Starting with smoking behavior. Related to sub-research question 1. We found that males are significantly more likely to be current smokers and exposed to second-hand smoke, while females are overrepresented among former and non-smokers. However, females still face substantial passive exposure, likely from domestic environments, highlighting the need for gender-sensitive public health education, especially around home-based risks. Moving to socioeconomic status, which is relevant to sub-research question 2. We observed that individuals with higher socioeconomic status and better healthcare access generally had higher 5-year survival probabilities. But interestingly, the group with poor healthcare access showed slightly better median survival than the group with good access. These findings contradicts expectations and may affect limitations in the dataset or confounding factors such as earlier diagnosis or regional differences. Finally, the heat map on environmental exposure revealed elevated mortality risk when both indoor and outdoor pollutions were present, especially in occupational settings. These results suggest a compounding health burden that calls for urgent regulatory action, not just in public spaces, but also in workplace and homes. That is relevant to sub-research question 3. Now let's move into the conclusion. In conclusion, this analysis has shown that lung cancer outcomes are not determined by biology alone, but also by complex social, behavioral, and environmental factors. We identified clear gender differences in smoking and passive exposure, as well as disparities tied to socioeconomic status and access to care. Based on these findings, several recommendations have been proposed. First, public health campaign should be more targeted, particularly toward male smoking behavior and household environments where second-hand smoke affects women and children. Second, addressing healthcare inequality is vital. Expanding screening programs in low-income and rural regions can support earlier diagnosis and improve survival rates. Additionally, strengthening environmental regulation through clean fuel subsidies and workplace safety can reduce the compounding risk of air pollution. We also suggest implementing integrated monitoring systems to help identify and intervene with high-risk populations proactively. Further research should expand on this foundation by using longitudinal data and incorporating genomic or lifestyle variables. Ultimately, this project underscores how data storytelling can support more effective, targeted, and equitable health strategies on a global scale. With that, I conclude this video report and thank you very much.